I'm Dr. Ellie Stein. Welcome to my video tip of the month for June 2024. In this video is, will immune modulators help people with long COVID? Part 2, Baricitinib. Right. So to be honest, before I started researching studies for this video and blog, I actually had never heard of Baricitinib. But I knew immediately, looking at the spelling, it ends in an IB, and I know that drugs ending in IB and AB are typically monoclonal antibodies specifically designed to modulate or calm certain aspects of the immune system. These class of drugs are often used now in autoimmune disorders. And this drug, Baricitinib, is in a category called Janus kinase inhibitors, or JAK, J-A-K inhibitors. And basically, it calms inflammation. But what's interesting about Baricitinib is it also has antiviral properties. And a previous study by the same authors, the same investigators, showed that it improved the outcome quite significantly in people in ICU with acute COVID. Now, what's key for this study is it's not really clear whether people with acute and long COVID have the same underlying biology. If they don't, then they won't respond to the same treatments. So this study may help shed light on that. The lead investigator is Dr. Wes Ely. He's at Vanderbilt University in Tennessee. He describes a study where 550 individuals are going to be randomized. That means with nobody knowing which group they're being placed in, they're going to either get the active ingredient, the Baricitinib, every day for about 24 to 26 weeks, or they're going to get a placebo. Now, to get into the study, a person needs to have some kind of proof, even if it's a home COVID test, that they've actually had COVID. They have to have symptoms lasting 6 months beyond the initial infection, and they have to have cognitive symptoms on testing, so objective evidence that something's going wrong in the brain. That's because this group is particularly interested in neuroinflammation and cognitive dysfunction following infection. This is a very intensive study. All of the participants are going to be tested before the study starts, after the 6 months of treatment, and then another 6 months later after they haven't been on the treatment for 6 months to see if any effects are lasting. They're going to have a bunch of tests, including cognitive tests, cardiopulmonary exercise tests, a whole bunch of inflammatory markers, test to see if there's any evidence of active virus on board, and of course, a whole bunch of questionnaires. Now, the bad news about this study is it's very in-depth. It's going to take a long time to collect that many people, and it's not due to finish until the end of 2029.